A photo shoot before the opening ceremony.
Please, why don't you join us?
European Commission President José Manuel Barroso and German Foreign Minister Guido Westerwelle were just two of the many guests who attended the opening of this year's World Health Summit. For 3 days, Berlin was once again in the spotlight of global healthcare issues. The fifth in a series, the summit took place at the German Ministry of Foreign Affairs. At the opening ceremony, Barroso talked about Europe's responsibilities. Together with German Chancellor Angela Merkel and French President François Hollande, he's one of the event's patrons.
It's indeed a pleasure for me to be here in Berlin, in the Foreign Affairs Ministry, in this World Health Summit, because in fact Germany is a country that has been doing great things for health in Europe and through Europe also in the world.
To focus the attention of the international community on matters of health. That's the aim of Detlef Ganten, the man who founded the summit.
I welcome you to the World Health Summit 2013 in Berlin.
Around 1,000 participants from 80 countries around the world attended. They came from medicine, from business, from social fields and politics, each with a singular perspective and a desire to tackle the multitude of problems and challenges facing global healthcare. The summit is a forum for many new ideas. A unique opportunity for everyone who takes part.
And they are coming with their own expectations, they are coming with their own agenda, and it would be a great mistake if an organizer of a meeting kind of has a precise idea on the outcome. Then you can only be restrictive and you can inhibit creativity.
But creativity can only blossom when problems are clearly identified. And guests like Nobel Peace Prize laureate José Ramos Horta discussed some uncomfortable truths. At a symposium on the role of health issues in foreign policy, he talked about why weapons exports and pollution present huge challenges to healthcare professionals. And Nobel Prize-winning chemist Erin Chichanova highlighted the discrepancy between medical advances and access to healthcare.
There are hundreds of millions of people, if not millions of people, that are dying of diseases to which there is cure.
Identifying problems is only a first step. The second is to find solutions. Ghana's health minister emphasized how good healthcare is key to sustainable development.
We have been able to find some partners in the pharmaceutical industries, and then we have also been talking about technical cooperation, that will assist training, because you need skilled, health providers to deliver health service.
Lectures, symposia, and workshops were rounded out by the chats that take place in between programmed events. The wide range of topics looked at areas like medical research and development, but also at how scientific results can have an impact on policy. And this year, an upcoming generation of decision-makers were on hand to watch the event unfold.
The interplay and the sharing of ideas from different parts of the world and how it relates to countries in sub-Saharan Africa and in Africa was quite impressive.
It's great that we can come and have very direct conversations with other players in global health and exchange ideas.
I had a lot of opportunity to network, especially to identify people who can help our situations, as well as share our experiences with them so that they can improve their situations.
Yesterday evening was the World Health Summit party, fit night thing. So that was a great opportunity to meet some of the speakers, particularly who I'd wanted to have a chat to, having heard them speak throughout the day. So it's a good opportunity to go and have a chance to pester them and ask some questions and learn a bit more. So it's really useful.
Important feedback for Detlef Ganten, as well as the current and future summit presidents. Other topics included the upcoming regional meeting in Brazil and the one that took place in Singapore last spring.
When you've got a good idea, you try and export it. And so Professor Genton has taken the World Health Summit and taking it to different parts of the world. Singapore was very privileged to be able to host this in Asia in April, and the feedback has just been spectacular.
The closing event, an outlook for what's on the agenda in the coming year, and a call to provide a solid foundation for future global health care.
The first is education and leadership. Education is the best vaccination.
The World Health Summit builds bridges. See you there next year in Berlin.